So in Chapter 5, we're going to look at drugs, addiction, and the rewarding effects of drugs. This is a really interesting chapter, I think, and it's also one that we're going to rely on for the rest of the semester because a lot of the information here is going to come up when we start talking about other topics in the class, in particular when we talk about psychological disorders, so we can talk about how drug therapies work. So first off, let's consider what actually is a drug. A drug is a substance that has an effect on us because it binds to our body's receptors. And what that means is that any substance that is a drug is something that's essentially just making an alteration in how your body's functioning. And in our case, we're going to be looking at psychoactive drugs, so drugs that affect how we feel, how we behave, our mood, so on. And so we're going to be really concentrating on how a drug might influence the activity of your brain through its action on a particular receptor, or more likely a variety of receptors, for example, serotonin, dopamine, norepinephrine, and so on. So there often are going to be multiple receptors that are affected when a drug is used. And when we talk about drugs, we are going to be dealing with some of the ramifications of drug use, including addiction. Addiction can be identified by a preoccupation with obtaining a drug, compulsive use of the drug in spite of adverse consequences, and a high tendency to relapse after quitting. Part of addiction may or may not be withdrawal. Usually, yes, there will be withdrawal symptoms. And so withdrawal symptoms are the typically very negative effects that a person might experience when they stop using a drug. And then we were going to see in a moment that drug tolerance, the ability to consume more of the drug, is related to withdrawal. So let's take a look at tolerance then. And tolerance basically comes about because the body has made changes to compensate for a drug's presence so that the user feels fairly normal when using the drug. And this has to do with your body's attempt to maintain homeostasis, to resist the influence of a drug so that it doesn't affect us quite as much. So tolerance symptoms are going to be the opposite of the drug's effects. And not all drugs are the same with regards to tolerance. So the severity of tolerance varies with the type of drug and also the pattern of use, the frequency and the amounts used and so on. So there are a lot of variables having to do with tolerance. But always remember, we're going to be talking about homeostasis throughout this semester. And tolerance is directly related to your body's attempt to maintain homeostasis. When we look at the relation between drug tolerance and withdrawal, we can see that with repeated drug exposure, as we see here, the magnitude of the effect starts to diminish, right? So the more often a person, say, drinks alcohol, the smaller the effect of that given dose of alcohol is. And so what happens is people typically start drinking more and more, right? To maintain that same effect of alcohol, they have to continue to drink more and more than when they first started. That's essentially what tolerance is. So if you think about it, it's your body trying to counteract the effect of the alcohol by, in the case of alcohol, by getting better at digesting it, but also at reducing the effect of the alcohol that doesn't get removed from your blood during the process of digestion, reducing the effect of that alcohol that enters your brain then, and having your brain sort of reduce its sensitivity to it. And so as a result of those changes, a given dose of alcohol in a person who drinks regularly is going to have less and less of an effect. And that's tolerance. And again, that's what we're seeing right here. And after a person has developed tolerance, if they suddenly stop using the drug, which is what happens at this point in time here, And with that sudden withdrawal of the drug, the person may experience what we would call withdrawal effects or withdrawal symptoms. With no drug to counteract these changes, these adaptations that the body has made to try and maintain homeostasis, the person no longer feels, in a sense, normal, because normal is now a state that happens in the presence of the drug. So with the sudden removal of the drug, the person can no longer sort of experience that normal effect. Again, the body has adapted so well to the repeated use of a drug that withdrawal happens with the sudden withdrawal of, removal of the drug. And now we're really just feeling sort of those adaptive effects, or the change that the body has gone through to counteract the effects of the drugs. So the same changes that lead to tolerance produce withdrawal symptoms when the drug is not in use. And so this model of tolerance and withdrawal has been around us, for a long time. It's sort of been known for quite a while. Drugs that tend to have severe withdrawal symptoms, like nicotine and heroin and so on, are also those that people develop lots of tolerance to, and alcohol as well. So those are, examples of drugs that tend to produce lots of tolerance and then lots of withdrawal symptoms. There's also a learned component to tolerance, and that has to do with the environment in which we use a particular drug. And it's basically a learned association. So if you always drink alcohol with this group of friends when you get together every weekend, your body starts to anticipate that drug use at that, on those weekend outings, and so starts to compensate for them even before you start drinking. So the body's attempts to compensate for the drug can actually begin before you even consume a drug, and it can be connected to a particular setting or context or set of people that you would drink with or use any other drug with. A side effect of that is that when a drug is taken in a different setting where you don't normally consume the drug, it's much more likely to result in an overdose. So there are a lot of anecdotal instances of people overdosing on a familiar dose of a drug when taken in an unfamiliar place, unfamiliar setting.